Okay. Solutions, demands, and recommendations. The solutions are simple and have been made clear by the voices of those living in Skid Row. LA Can's existence and resistance is devoted to this struggle and will continue to fight until there is true change for the homeless. Pete White talks about the struggle to remove police as first responders in Skid Row. We have fought long and hard to move the police out of the road as first responders, in communities in Skid Row and other communities when responding to a call of someone in crisis. We know that ends awfully every fucking time. We know when we look at the overdeployment of officers who are untrained in this community, when we look at the uses of force by these officers, and when we look at the resources that are available citywide, that they are deployed out of our community but can't be deployed into our community, we know the outcomes are deadly. General Dogon also shares the importance of SMART teams being deployed in Skid Row. We've been fighting for SMART teams on Skid Row a long time. We all recognize the need for SMART teams to respond to issues that arise within Skid Row, because so many times on Community Watch we witness the takedown of somebody with mental disability, and the LAPD strategy has been to catch a person the same way you would catch a chicken. They get like 10 people, circle the person, and move in on them. That is their way of in the past of dealing with people with mental disabilities, is that they'll just move in real slow, and then all of a sudden everybody will grab a body part at one time. By you closing in on a person with this uniform on in this way, what you're saying is that you're going to deliver some pain into that person once you get up on them. That's definitely not how you de-escalate. In response to the continued atrocities of homeless and mentally ill residents in Skid Row and in Los Angeles by the LAPD in the past 2 years, LA Can has made demands and recommendations to the city of Los Angeles because outcomes oftentimes don't come in the ways you planned. These demands are: 1. To remove the Safer Cities Initiative task force from Skid Row. The concentration of officers within such a small neighborhood makes police interaction a regular occurrence and will prevent the necessary shift from police to Department of Mental Health for emergency responses and mental health crises. 2. End the LAPD's practice of policy by utilizing the Central Bureau's SMART teams solely for, or primarily within the Central Division building, after people in Skid Row community have been arrested and or transported to the station. This practice defeats the stated purpose of the SMART teams to reduce the potential for violence during police contacts. Utilize the existing SMART team in the Skid Row community to reduce the use of force, prevent arrests for non-serious offenses, and in the practice of handcuffing people with a mental illness who present no physical threat. Number 3. Ensure all Central Division officers are appropriately utilizing the MEU. I don't remember what that stands for. Mental Evaluation Unit. That one. Triage desk for resources and non-LAPD mental health resources to prevent arrests. According to Lieutenant Garcia, officer in charge of MEU, officers are required to call MEU triage desk for assistance when they encounter a mental health crisis on a response call. Release relevant data, call logs, and other information in monthly reports all about MEU programs to the public so that the community can assess the effectiveness and utilization rates of the programs. We talked about that in Chapter 2. I don't remember under which segment, but there was a FOIA, which is a federal request of information that LACAN and the Stop LAPD Spying did to receive that information. But it was only for like a 6-month period. Number 4, expand the SMART teams to ensure... I'm getting packages, finally. Expand the SMART teams to ensure citywide coverage 24/7 as recommended by the Consent Decree Monitor in 2005. In addition to the Central Bureau SMART team officers, there should be 24/7 coverage by a dedicated SMART team for Skid Row focused on reducing the use of force incidents and arrest rates. Note, a SMART pilot project to be deployed within Central Division Patrol was supposedly initiated in 2005 as a part of the Consent Decree compliance, but the community has seen no evidence or outcomes of it. The Consent Decree was done by the federal government. It was like a hold on stuff. But again, like most of the time, they just kind of waited it out, okay? These expansions should solely be funded by LAPD with their existing budget and could be partially accomplished by ending and redeploying the Safer Cities Task Force. LAPD claims it needs resources from the Department of Mental Health for the mental health professionals on the SMART teams, but there is nothing preventing LAPD from hiring mental health professionals directly as civilian employees. Number 5, create a policy and standard practice for SMART teams to police calls from buildings dedicated to housing people with severe and chronic mental illness within Skid Row. Ensure the policy includes identifying these calls under 911 protocols as well. Number 6, ensure the Mental Health Crisis Response Program Advocacy Board meets regularly with Skid Row community to ensure full transparency of the development and outcomes of the MEU, including SMART and CAMP within the Skid Row community. Increase awareness and utilization of CAMP's activities. I don't think we talked about CAMP. Again, this was written by LACAN. I'm just moving it over. I don't remember what CAMP is. It was one of these programs done by the city. Anyway, increase awareness and utilization of CAMP's activities in the Skid Row community as a means to increase access to services and decreasing arrests and incarceration. Improve CAMP outcomes for people who are homeless, who, according to Lieutenant Garcia, have lower success rates in CAMP than those who are housed. Again, housing is the solution. Pete White explains these demands and recommendations. We are calling for the addition of more SMART teams because the citywide SMART teams that are trained to deal with people in crisis are based in Skid Row and Central Division, but they are not deployed in Skid Row. So on the one hand, fighting to ensure that there is a team of an officer and a clinician who are actually in the community getting to know people. More so, the clinician who isn't really locked into the blue code of silence, but at the same time, we're attempting to do that small thing. We're also on the county side attempting to shift to models that we know used to work, right? Like psychiatric emergency response teams and other teams they deploy in the community where they are trained people and clinicians and others who have relationships with people. We feel like we needed to have another model, get police out of it, and a different set of eyes on the ground who can bear witness, right? And to a different set of players thinking through crafting policies. Along with the city recommendations, the county recommendations are, number 1, increased resources for the Department of Mental Health's Emergency Outreach Bureau teams, including but not limited to the psychiatric mobile response teams, to ensure 24/7 availability in Skid Row, and public education outreach to increase the utilization of mental health response teams instead of police or security interventions. Training and educational promotional materials are needed throughout the community to change the practice of calling the police in response to mental health systems that are not crimes. Ensure any changes in policies and resources are incorporated into 911 protocols as well. Number 2, a change in policy and practice to ensure that Department of Mental Health and other mental health outreach and or emergency response workers are not accompanied by the LAPD when no crime has occurred or been reported. And number 3, in order to reduce mental health emergencies and or incarceration as a mental health intervention, recommendations are first, a dedicated allocation of the county's mental health diversion pilot project funding to Skid Row for housing, services, and other non-criminal justice interventions for at least 50% of the remaining pilot program slots. The next, transparency in the mental health diversion program so that the public can ensure the program is both cost-effective and reducing incarceration and improving health and housing outcomes. And last, a significant expansion of the mental health diversion pilot project with set-aside allocation for the Skid Row community. I think the last part of this chapter is organizing and action, and I am going to do that in the next part.